So a lot of our patients come in with skin-related concerns. One of the very common concerns we get is enlarged pores, or related to that, people who've had cystic acne and other problems that now have acne scars. There are various treatments that are available, like steroid injections, subcision, but we're going to focus on laser today.
Yeah, obviously the first line is that you have to control the acne itself. If you've got active cystic acne that's continuing, we need to get that under control. But if you're sort of past that point and what you're left with is the actual pitted marks or large pores, sort of like what I have, what we've really focused on most recently is what are the different laser modalities, and one of the things that's been really fruitful has been the 1540.
Yeah, so for those who don't know, we've talked about it a little bit. Our 1540 laser is a fractionated erbium laser, which is really very, very effective at helping to deal with skin issues related to skin texture, skin quality, and loss of skin tone or elasticity.
Yeah, what's really important with this sort of thing is an understanding that this is not a one-off. You're not going to be able to come in and do one treatment and get a miracle. It really does require a series of treatments, but with that, there's some really meaningful changes. We've found over the last many years that what is really required is a pretty aggressive approach, where if you're just doing sort of one pass and not really having much downtime, you're going to need a lot more treatments. But if you're relatively aggressive up front, then you can get some really meaningful results after a couple of treatments.
Yeah, so that sometimes combined with IPL if necessary are really going to help a lot with the red, the discoloration of the scar itself, but even more so with the quality of the scar, the fact that it's pitted, thinned out, and the skin looks different than the surrounding skin. After a few treatments, that can really make a huge difference in terms of evening out the skin tone.
Absolutely. So it's really important, if you're doing this or thinking about this, you got to be aggressive. You got to be willing to have a little bit of redness and swelling even potentially the day after, maybe for 2 days, but not more than that. So it's not a lot of downtime. It's not a painful treatment by any means because we numb you up, but it does require a little bit of extra oomph.
Yeah, so if you can give us a couple of days of downtime, you can get a really tremendous result.